Hey everyone, welcome back to the channel. Today we're diving into a super important but often overlooked topic, measles immunity in patients on biologic therapy. If you or someone you care about is on biologics for an autoimmune condition, stick around. This one's for you. As always, this video is for education and inspiration only. Definitely not a substitute for medical advice. Talk to your healthcare provider before making any changes. Biologic medications have been game changers for autoimmune and inflammatory conditions, but they come with some trade-offs, especially when it comes to vaccine-preventable illnesses like measles. And with measles outbreaks popping up again in different parts of the world, checking your immunity status has become more than just good practice. It's a way to protect yourself and your community. So here's the science part, but don't worry, I'll keep it simple. Biologics like TNF inhibitors, IL-6 blockers, IL-17 inhibitors, and B-cell targeting drugs like rituximab can affect how your body remembers infections. They can reduce your ability to produce antibodies and respond to vaccines, especially live ones like the MMR vaccine. Most adults do retain immunity from childhood vaccines, but that protection might wear off faster if you're on certain biologics, especially B-cell depleters. Here's what we know right now. Most people still test positive for measles antibodies, which is a good sign, but those born after 1957 or who only got one MMR dose might be at higher risk. TNF and IL-6 blockers can weaken immune responses slightly, but don't usually erase past immunity. On the other hand, rituximab, that one's a heavy hitter. It can seriously reduce your body's ability to fight off measles. All right, let's talk real-life action steps. If you're about to start a biologic, first, get your measles IgG antibody levels checked. If you're not immune, get the MMR vaccine, 2 doses, 4 weeks apart, and then wait at least 4 more weeks before starting your biologic. If you're already on a biologic and find out you're not immune, you can't get the MMR vaccine while on the biologic. It's a live vaccine. Instead, you'll need to pause your biologic for 4 weeks, get vaccinated, then wait 4 more weeks before restarting treatment. I know, timing can be tricky, especially if your symptoms are flaring, but it's doable with planning. If you're on a biologic, here's your quick checklist. 1. Ask your doctor to check your measles IgG level. 2. If you're immune, great, nothing more to do. 3. If not, talk about pausing your biologic to safely get vaccinated. 4. And during outbreaks, if you're not immune and can't get the vaccine, you might qualify for post-exposure protection with immunoglobulin. Let's sum it up. Screen for measles immunity before starting biologics. Finish your MMR series before beginning therapy. Never give live vaccines like MMR while on biologic meds. If someone's already on therapy and not immune, plan a temporary hold to vaccinate safely. And remember, rituximab-treated patients are at the highest risk and may stay unprotected for months. There's still a lot we don't know, like how long immunity really lasts in biologic-treated patients and how well revaccination works. Also, researchers are working on developing non-live measles vaccines, which would be a total game changer. At the end of the day, it's all about thoughtful, proactive care. Knowing your measles immunity status is a small step with big benefits, protecting you while allowing safe and effective treatment with biologics. If this video helped you better understand the intersection between vaccines and biologics, hit that like button and consider subscribing for more science-backed breakdowns. Got questions? Drop them in the comments below. I'd love to hear from you.